Hello, and a warm welcome to the educational and interesting video presentation that we have carefully prepared for you today. The presentation today will be dedicated to discussing the serious health condition better known as osteoporosis, a disease that severely impacts millions of elderly individuals worldwide. Osteoporosis is indeed a very serious disease that weakens bones, making them more brittle and far more prone to fractures or breaks. Throughout the duration of this information-filled video, we will be getting to a closer look at osteoporosis and what exactly it is, along with how multifaceted a health condition it really is. We will also study further how gradually, over time, this disease develops and explore the processes and factors involved which lead to its development. And most importantly, we will also talk about the numerous steps and methods by which older people can take proactive early action with the aim of avoiding osteoporosis, or if it has already developed, managing it more effectively. So with no fuss and no delay anymore, let us move and get right into this important matter. What is osteoporosis? Osteoporosis is a word that literally means porous bones, which tells us a bit about the condition itself. As we age, our bones slowly begin to lose density, causing them to grow progressively weaker over time. When the density of our bones drops to a point that is deemed too low, the result of this process is osteoporosis. What this condition does is lead to the unhappy situation where bones become brittle and can easily break, which quite often happens from something as slight as a gentle bump or an easy fall. Symptoms and risk factors. Most of those who suffer from osteoporosis are typically not aware of it until, unfortunately, they experience a break or a fracture in one of their bones. It is notable that there are several common signs and symptoms one should look out for, which consist of ongoing pain or a constant ache in the back, an apparent loss of height over the years, or an apparent stooped posture that might begin to set in over a period of many years. The only question that arises then is, who precisely belongs to the group that is supposed to be at risk of this condition? Women are particularly prone to this condition, especially after the menopause stage, which highly raises their chances of developing osteoporosis as they age. However, it is crucial to understand that men cannot be excluded from this risk as well, as they can be victims of this severe health condition too. In addition, there are several other risk factors for the likelihood of an individual developing this condition, and these factors include advancing age, family history of osteoporosis, poor diet, lacking crucial nutrients, lack of sufficient exercise, smoking, and excessive consumption of alcoholic drinks. How osteoporosis develops as we age. The human body naturally and constantly experiences a process where the rate of new bone formation significantly slows down in comparison to when we were younger. At the same time, the rate at which the body breaks down and resorbs bone and deteriorates, it speeds up considerably. The imbalance between bone resorption and new bone formation processes results in a considerable and notable loss in total bone density. The resulting decrease in bone density then causes the bones to become far weaker and more brittle, making the bones much more prone to fracture and breakage. In the elderly, such a process of imbalance can, in fact, occur at a much faster and more alarming pace, particularly if these individuals do not consume high enough levels of essential nutrients, which are significantly important in facilitating healthy bone integrity, such as vitamin D and calcium. Such nutrients are significantly important in enabling the support and maintenance of healthy bones. Diagnosis. The time period is from 6:01 to 7:30. In an effort to effectively diagnose osteoporosis, physicians can perform a specific type of test known as a bone density test, also more simply called a DEXA scan. This particular test is quite easy and is even specifically designed to effectively measure the density and the strength of bones, typically on areas that are of specific significance, such as the spine and the region around the hips. The early detection of the condition will significantly help prevent fractures and also make it simpler to come up with a more manageable approach to dealing with the disease throughout time. Prevention and lifestyle changes. While it's true that osteoporosis appears to be more and more common as we get older, some very good and hopeful news needs to be shared with everyone. You can play an active and preventive role in doing something that will keep your bones strong and significantly minimize the risk of acquiring this disease in the years ahead. First, you must begin incorporating a good and balanced diet that is filled with vitamin D and calcium into your lifestyle and diet on a daily basis. Dairy foods, which include a wide variety of foods like milk, cheese, and yogurt, as well as a wide variety of leafy green vegetables like spinach, kale, and collard greens, and a wide variety of fortified foods that have been fortified with key nutrients, are all excellent sources of these essential nutrients that our bodies require to be in optimal health. In addition, maintaining regular physical activity, particularly weight-bearing exercise like brisk walking, jogging, or weightlifting, can also play an important role in maintaining and enhancing healthy bones throughout life. Medical treatments, for others, lifestyle modification will not be sufficient to produce positive health outcomes. Hence, physicians might opt to prescribe drugs that are specially formulated to slow the rate of bone loss or, in some cases, cause the formation of new bone tissue. These medications are available in a variety of forms, including oral pills that are swallowed, injectables that are administered using a needle, or infusions that deliver the drug directly into the veins. Be frank and well-informed with your healthcare provider so as to determine the most effective and appropriate treatment that best fits your individual case and situation. Fall prevention strategies. One of the most perilous threats that is inherently linked to osteoporosis is, by far, the heightened susceptibility to falling. Given that older individuals frequently end up fracturing their bones as a direct consequence of such falls, this unfortunate circumstance could thus give rise to severe and debilitating medical complications that can significantly detract from their overall quality of life. Hence, it becomes necessary to undertake a chain of preparatory measures with the only aim of making your home safe and secure. You can do this by systematically eliminating any potential tripping point that would lead to a hazard. It also stands to reason that you use non-slip mats wherever slipping is likely to occur, as these are able to minimize the chances of accidents to a significant degree. Furthermore, the use of stable handrails within the bathroom and along the stairway is crucial in order to provide additional support and enhance the level of safety around your home. Besides other measures, having a pair of good quality shoes with an excellent grip and stability is of utmost importance, as it can play a great role in reducing the risk of falls. Furthermore, the utilization of supportive devices such as walkers can be of considerable worth in regard to safety and prevention of accidents, thereby making oneself feel improved and safe. Living with the condition that is commonly referred to as osteoporosis. Having osteoporosis does not necessarily mean that you must entirely give up on enjoying life in all its beautiful and enriching forms. On the contrary, by adhering to the right type of care and making thoughtful modifications to your daily routine and lifestyle, you can still enjoy an active, vibrant, and fulfilling quality of life, the same as you enjoyed before the diagnosis. What is essential is to prioritize having frequent consultations with your physician so that you may discuss your condition and any changes needed in your treatment plan. It is also essential to religiously adhere to taking your prescribed medication on time and on a regular basis, and to actively engage in a lifestyle that promotes health and well-being. All these steps can go a long way in enabling you to successfully manage your osteoporosis and avoid ensuing complications. Conclusion: what we should remember is that osteoporosis, as risky as the disease may be, is in fact manageable, and doing something about it, in terms of early prevention, can actually create a big difference in one's life. It is very important to be proactive when it comes to your bones and to actually encourage the elders in your life to do the same and take similar actions to ensure they pay attention to their bone health as well. I would like to thank all of you from the bottom of my heart for taking out your valuable time to view this crucial and important message that we shared today. I would also like to respectfully remind you all to kindly take a moment to like this video and subscribe to our channel, as this will help ensure that you keep getting more precious and useful health tips in the future. Finally, I would like to wish all of you the best of health, and I urge you to please try your best to take very good care of your bones. Stay safe and take care. See you in the next Health for Seniors videos.